Hello, my name is Sergeant Ellis. I am the course coordinator for the Fort Indian Town Gap Mystic, and I am a critical care flight paramedic with the 2nd 104th GSAB out of Pennsylvania. Today we're going to be talking about canine medicine and the overall assessment tools that we'll use as 68 Whiskies. So all 68 Whiskies are familiar with the March algorithm. With dogs, it is exactly the same. We're going to be doing S-March, however. So the S standing for secure and safety, M standing for massive hemorrhage, A standing for airway, R is respirations, C for circulation, and H for hypothermia. The military is taking a higher priority on treating our military working dogs. We used to see them as solely tools that we use, but now we are starting to prioritize them as United States soldiers. So your order of precedence in regards to treatment is going to be United States soldier, United States military working dog, NATO allies, and then anyone else. Okay, so starting with S. S means secure and safety. The 68 Whiskies, or whoever's caring for the military working dog, safety is paramount. These dogs are weapons, essentially, right? We have to consider that this dog may have some type of brain injury, or it may not recognize you, and there may be it may try to bite you, okay? So when we go to secure a dog, if the canine handler hasn't already, what we'll do is we're gonna reach down and grab the farthest most paws, or the farthest most legs. We're gonna tuck our elbow in and into the neck, and we're gonna put our head down and facing away. The purpose of this is to try to secure the head and secure the legs. Dogs will try to weasel their way out of any hole they can find, and if this dog is erratic, this is the best appropriate method to do so. When we have an animal and we secure the animal down, then we're going to have to muzzle. So the muzzle always comes first. Regardless of injuries going to the animal, we have to muzzle it first. It can be done with a commercial muzzle device, or it can be done with an improvised device. A typical canine handler will have a single commercial use device. They'll have a secondary muzzling device, which is typically some type of Velcro, or we can also use Curlix, which I will show you here. So Sergeant Guzman is going to come in and he's going to secure the dog. While Sergeant Guzman is securing the animal down, I'm going to take my Curlix and do a single overhand knot. Again, this is in the case that I don't have a commercial muzzle already. Okay. Now I'm going to essentially lasso the dog's mouth and snout. And we're going to put that overhand knot the same way you tie your shoes on the bottom of the jaw. Now when we close this jaw up, we don't want to close it entirely. We don't want the snout and everything to be closed up, because the dog still has to be able to breathe, just not bite. So after we do that, right, we'll leave them a little bit. And then we're going to take it, we're going to tie the knot with a second overhand knot, same way we tie our shoes, over the back of the head. Now if this dog is erratic, if this dog is trying to actively bite, snip, or whatever, then it may be a smart idea to consider some type of chemical restraint or chemical sedation prior to putting your hands near the mouth. After the dog has been muzzled, if it continues to fight, what we're going to do is we're going to consider a chemical restraint, so that way we can continue through the rest of our assessment, care for this animal, while also keeping ourselves safe. What we'll use to consider deep or mild sedation will be Versed 0.3 milligrams per kilogram, coupled with either hydromorphone or morphine. And if we're going to consider deep sedation and totally sedate this dog, then we'll consider Versed and ketamine for sure. So now we're going to talk about M for massive hemorrhage. So we have already secured the muzzle, and we may or may not have had to chemically restrain the animal. Okay. So now, just as we do on humans, we're going to do our blood sweep. So we have to do a very thorough blood sweep, checking every inch of the dog, because the fur may lay over an injury that we can't see or can't find immediately if it's not bleeding out extremely hard. So we're going to go through, we're going to check everything. If we should see something like this, an amputation of a leg, either front or back, what we'll use, you can use a cat tourniquet, the same one that we have in an IFAC, if you have nothing else available. However, when you do put this on, you want it so the windlass is on the outside, as high up as you can go, and windlass on the outside. In the case that your canine handler is there, they always have a separate IFAK specific to that dog. In that IFAK, you may see something like a SWAT tourniquet, a SWAT T. If you are not familiar with this, you should try to get your hands on one and start using it as soon as possible. So we just finished massive hemorrhage. I applied a SWAT T tourniquet to my amputation. If we should find that there's a wound that needs packing, then we would do that as well. Now we're going to move on to A for airway. So if the dog is still breathing with the muzzle on, they're still getting air in and out, and their lungs are still expanding, we're seeing that chest rise and fall, then what we'll do is we'll apply oxygen via blow-by right in front of their face. Okay, so this oxygen non-rebreather mask is already attached to my oxygen tank at 15 liters, and we would just set that right in front of their face. We can secure it to the muzzle, or we can secure it to something else so it stays there, and if anything should change, then we can move forward. If the dog is having low pulse ox, even with high flow O2 going via blow-by and non-rebreather mask, and if they're having continual respiratory distress or difficulty, we want to highly consider intubation. So the way that we'll do intubation is number one priority is making sure that this dog remains chemically restrained. So if that means resedating them with a higher dose of Versed or ketamine, whatever you have available to you is going to be important. So once this dog is chemically restrained, we remove the muzzle. And what Sergeant Guzman is going to do is he's going to put his hands underneath of the snout, and he's going to put his thumb and his middle finger behind the canine teeth, these big sharp ones like this. And then his second hand is going to pull down that lower mandible. So from here, you want to utilize a Miller blade and a 9 to 11 millimeter tube. And you're going to essentially do a tomahawk method to pull the tongue and epiglottis out of the way. And then you're going to insert your tube. You do not need a stylet. And you also don't need a Miller blade. What you can do with most dogs is just pull their tongue down, and then you'll be able to just slide your tube right into the right place. Okay, so now we do that. Okay, Sergeant Guzman, you can close the mouth. And now I can attach my BVM, and I can check for rise and fall of the chest. So this position is called sternal recumbent. And then once we are completed and we confirm that the placement of our tube is in the right spot, then we can lay the dog back down on its side. Now that we've intubated the dog and we've chemically sedated them, we'll breathe one breath every 3 to 5 seconds. And we're going to mark the time that we put this in, the depth of the tube to the teeth, which in this case is 29, and then we have to secure it. We can't use the same commercial securing device that we would on a person. So what I've done here is I've used that same Curlix I used as a muzzle. I tied a single overhand knot on both the tube and the top of the snout, and then I did the same overhand knot underneath the lower mandible and in the back of the head. So now this dog is, or the ET tube is secured, and in the case that he should wake up, right, we still have him muzzled. In the case that your dog has maxillofacial trauma, trauma to the inside of the mouth, or a lot of signs of burns and stuff, what we'll do is we can move forward with a cricothyroidotomy. So one good idea to have in your aid bags is a disposable razor kit, so that way you can shave off all this fur to find where the cricothyroid membrane is. This is going to be me simulating shaving that, pulling the zipper down. Okay, and then we're going to expose just this whole area. And by exposing this area, we're going to find that they don't have necessarily an Adam's apple, but they do have those cric rings that we can look for, or excuse me, those trach rings that we're looking for. So we're going to start by sterilizing the area, pulling out our scalpel, making our first incision, 1 inch, vertically, and then puncturing through the membrane horizontally, grabbing our trach hook as such, inserting our cric tube, removing hook, removing the introducer while holding everything in place, filling up our 10 cc syringe, and now we have a cric. Now we have the ability to ventilate this patient, and we'll grab our BVM, again confirming placement. looking for equal rise and fall of the chest, in which we have. And now we can secure this with the appropriate commercial securing device that comes in your crate kit, or you can utilize gauze or tape, whatever you have. So now we've completed M for massive hemorrhage, we've completed A for airway, and the dog is still muzzled, so we are still being secure. Now we're going to move into R for respirations. For respirations, the average parameters for dogs is between 16 and 32 breaths per minute. So when we go to respirations, we're doing the same thing we did on humans. We're looking for any type of entry wounds, exit wounds, anything that can affect the breathing. So when we go through, let's say, for example, we have a dog who has an occlusive dressing placed over a gunshot wound, and now they're starting to develop increased tachypnea and unilateral rise and fall of the chest. Or maybe we may not be able to see unilateral rise and fall of the chest. What we have to consider is that dogs have a fenestrated sternum. So with that fenestrated sternum, that means that they can have a tension on Diesel's side here, it'd be right side. So let's say he has a tension pneumothorax on the right side. Because of this fenestrated sternum, that air and that pressure can start to build and transfer to the left side. So when we go and we consider doing a decompression on a dog, we maybe have to do it on one side to relieve the opposite, if that makes sense. The site for a needle decompression on a dog is going to be either pull up the arm, the forearm here, and the elbow will typically tell you where you have to go. So you pull that elbow up, so you're coming up, and once that elbow hits the center of the chest, that's a pretty good indicator. The other way that you can tell where to insert an NCD is if you take your hands like this, put this pinky or the farther pinky down on the very last rib you can feel, and put the right one at the top of the shoulder blade. Now this can vary depending on hand size, so like if my hands are bigger than someone else's, you know, it may shift a little left, shift a little right, but typically it puts you in the right location. So if I do it like this, then I know my NCD location is going to be right here. So what I'm going to do is I'm going to mark that with my finger. If I have an alcohol swab, then I would swab the area as best I can, getting underneath of the fur and going to the skin. We're using the same 14 gauge needle that we would on humans. What we're going to do is you just insert that straight down. Okay, and then once we hear a hiss, we can move further, or until we meet resistance, we can move further and then we stop. And we listen for 10 seconds to hear a hiss. And then dispose of sharps appropriately. This is typically how most dogs will take an NCD, where you have this little bit of gap on the catheter, and that is perfectly fine. So now we've completed M for massive hemorrhage, A for airway, and R for respiration. Now we're going to move into C for circulation, where we're going to check for a pulse and then start an IV or IO as indicated. Okay, so for finding a pulse on a dog, what we want to do is go into their hind leg close to where their femoral artery is, and we're going to feel with 2 fingers. This is one of the most prominent spots where you can feel a pulse. The other way, which is not necessarily the best, is you can feel on the chest to see if you feel a heartbeat. That doesn't give you a necessary indication of pulse to blood pressure, but it is a way to tell if they are shunting or if they're starting to go into decompensated shock. Okay, so now that we've found that this dog has pulses present, we want to start an IV or a saline lock. If you have the saline lock that has the little extension tubing on it, the 2-3 inch extension, those work the best typically just because we have to wrap it a certain way. But I'm going to show you with the materials that you'll most likely have. Okay, so what Sergeant Herman is going to do here is he's going to grab the dog's elbow, and try to squeeze the elbow. So when you squeeze the elbow, what it'll do on most dogs is it will cause their arm to extend, which will give you that straight line for the IV site. This is the better of the 2 IV sites because dogs are typically trained better and this is less sensitive to them. So their arms will expose, they have a vein right here. They also have a vein on the inside of their hind leg, but I'm going to show you this one. So in this case where Sergeant Herman is holding the elbow, I don't need a tourniquet because he's going to be reducing the amount of vasculature return. So these veins are going to pop up anyhow. So once I identify my site, okay, it's all the same things as on a human. We're going to clean the site as best as we can. Okay, then we get inserted at a direct angle, we get a flash, we drop down, and then we advance our catheter. Okay, it's all the same as it is on a person. Okay, good, and we flush. So now that I have the saline lock on this patient, I don't want Sergeant Herman to release just yet. Instead, what I'll do is I'll take some Coban, wrap that underneath, and then wrap it over top. Just like this. So now, in the case that this dog should wake up, or if anything should happen or slip, now this is a more secured line. And if you do use the 3 or 4 inch extension, it'll just hold it that much better. If the patient's vasculature is very poor, or if all 4 limbs are blown off and we can't find an appropriate vein, what we can do is we can go for an IO on these military working dogs. Your sites are going to be the anterior shoulder. So right here, this is the shoulder blade for the dog. It would be right here, right on the anterior shoulder. Or if you're on the hind leg, it's the same as on a person where you're doing that proximal tibia. Okay, so you find your joint line, you come down, and it's right there on the proximal tibia. You can use 2 different types of IO catheters. You can either use the blue 25 millimeter, or you can use the red 15 millimeter. In this case, I'm going to use the blue 25. So we are going to wipe down our site, ensuring we're in the right location. All right, there we are. I'm in the right site. I'm going to clean off my site as best as I can. Using my EZ-IO, we're going to insert at a 90 degrees to the animal, zip in, remove our needle and dispose of sharps appropriately, and then we attach our lock connection, which we get, and we flush. So now we've just completed our circulation phase, and now we have to start considering hypothermia precautions. So for the hypothermia precautions for a dog, we have to keep in mind that between 99.5 and 103 degrees is normal internal temperature for a military working dog. Their temperatures can get up to 107 degrees Fahrenheit. So we have to start to consider if this casualty is going into hypovolemic shock, if they're unable to hemoregulate, then we will cover them in a blanket, we'll cover them in a blizzard blanket and transport them that way on a litter. As it pertains to medications and doing your pulse assessments on dogs, the canine handler will have a specific medical drug card to his animal. A lot of times we'll find that other canines that work with that animal will have the same one. So doing drug calculations and everything will be on a separate card specific to you, so it makes it very easy. Thank you very much for paying attention. My name is Sergeant Ellis. My contact info will follow this outro, and I hope you have a great day.